Denise Noyer-Erez here, also known as the Fertility Godmother, and today I wanted to chat with you about recurrent pregnancy loss. I've had several women come up to me, and actually a husband even come up to me in the last month, just coincidentally for October being Infant and Pregnancy Loss Awareness Month, I think. I see a lot of women who have had recurrent pregnancy losses and can't hold a pregnancy, right? It's completely different. No problem getting pregnant, but the problem really resides in holding on to the pregnancy and making sure that the baby is healthy. So please, if you know somebody or if you're going through this, please share and like this video because this can be really helpful for you. First, I want to share with you, if you haven't already, you want to make sure that you've had some testing done. It's really important to make sure that you have proper medical testing done. Make sure that there's nothing in the uterus that is causing a miscarriage. Make sure that you do it's called a thrombophilia panel or a recurrent pregnancy loss panel. You have to advocate for yourself and make sure that everything comes back normal. You want to make sure, check in that as well. Like it's called MTHFR. Check that. Make sure that you don't have something that you're methylating properly, okay? Make sure that you're not clotting. That's what the recurrent pregnancy loss panel does. It's a thrombophilia panel and it looks for inflammatory markers and it looks for to see how you're processing, but if your blood is flowing or, and if everything comes back normal, well, that's great. And it also might be scary for you because you don't know what to do. If something comes back wrong, then you have a medicated way of supporting that pregnancy. Sorry, I don't know if you can hear the helicopters. I don't know what's going on. The helicopters are going off right now, but you can use medication to help support the pregnancy, and then I'll share with you some ways that I do that as well, because this is my specialty within the fertilities. I help women get pregnant and stay pregnant, and the staying pregnant obviously is so important. So you want to make sure that you're checking, just like kind of a quick review. You want to have, if you haven't already, you want to go through your blood work and make sure you had recurrent pregnancy loss panel or thrombophilia panel, and they check for blood clotting factors and inflammatory markers. You want to make sure that the uterus is, clear and has a nice thick lining and there's not a lining issue. And if you had the chance, if you were going through a miscarriage, or if God forbid you have to go through another one, you want to test the tissue of the baby to see if it was normal, because that's going to give you a lot of information. And assuming that it was normal, and there's something going on with your body that's not able to support a pregnancy, and the next step for you to do would be to take a pause and work on getting your body really healthy and nourishing your body, rebuilding your body up, improving your egg quality, and having your partner improve his sperm quality. And I know that's very specific, very broad. I'm sorry, it's very broad, but and you may need more specific guidelines, and I'd love to be able to help you with that. But you really want to be as healthy as possible. And when you get pregnant and you miscarry, even though you didn't make it all the way through the end of the pregnancy, you have to remember that your body was really working on giving that embryo everything. And it's really important to nourish yourself again and allow your hormones to get back in balance. And you can do that through several different ways. One is rest, meditation, but eating is going to be a really big deal for you. Eating properly, because you're eating all the time, right? You're eating several times a day, and what you put in your body makes a difference. And the other thing is, what I do when I have couples that come in to see me who have had recurrent pregnancy losses is I help get their body ready. Usually we do the Prepare to Get Pregnant fertility cleanse, and then I put them on the Chinese medicinal herbs, and it's a specific formula created for you that I do depending on what's going on with you and your body. And you stay on that formula until you are safe in your pregnancy, and sometimes all the way to the end. And that's what I do with my patients, with the women that come in who've had more than one miscarriage. We support them through, sometimes we support them through acupuncture, but the biggest thing is getting their body ready and then putting them on an herbal formula. And I have great success with this. I have 3 women right now who've had 3 or more miscarriages, and they are into their 2nd trimester. So exciting. So I know that there's a possibility, and I just want you to imagine that it can happen for you. And I want you to know that if you can get pregnant, then you can have a baby. And I want you to hold on to that mindset and don't believe that your body is not capable. It may just need a little additional support. And the trick is going to be to find you the right support for that. And I would love to be able to help you with that, whether guiding you in the right direction or supporting you all the way through your pregnancy. So if that's something that you would be interested in finding more about, just go ahead and share how you're feeling in the comment section and let me know if that's something you want us to help you with. And I'd be happy to figure out a way to do that. And I also want you to go ahead and we're going to offer a free, I have a free download for you that you can have. I don't know if Haley's going to have it ready, but she's pretty amazing. She might have it ready. So just comment below, and if it's not ready, we will send it to you as soon as it is. I'm just tweaking it a little. If you know anything about me, I'm always trying to improve and update things. And we are improving our recurrent pregnancy loss gift. So, and knowing her, she probably will have it done for you. So that being said, make it a great day. Here's to your health, happiness, and fertility. And let me know if I can support you in any way.